Okay. Well, welcome everybody to another edition of Easton Leads. This is COVID-19 and the Mental Health Forum. And I'm really pleased to have several friends and colleagues help me have an honest conversation about the impact of COVID-19 and quarantine on all of our mental health. So we have Easton resident and mental health therapist Mary Dobson. We have Dr. Wendy Cook Broderick, and also Easton resident and professor. And we have Dr. Carissa Phipps, one of my colleagues and leading telehealth experts in Connecticut. So I thought we would start by just acknowledging that COVID-19 is impacting our brains close to pretty much 100% rate, infection rate of our mental health, because including all of us healthcare professionals. I'm Ann Hughes, by the way, not just your state representative, but also a licensed LMSW, licensed Master of Social Work. Yes, that's what I am. But more than anything, we are all people in this global pandemic, and including our mental health professionals, our mental health is all of us are being impacted. There's a given that three things: mental health depends on our strong social networks to combat social isolation. We're hardwired as a social species. It depends on our strong personal connections for resiliency to loneliness of quarantine and pandemic, staying home or staying away from people. And third, our mental health really depends so much on our economic safety and health and well-being to combat stress. And since it's being impacted on all three of these, most of us, or at least 2 out of 3 of most of us, beyond the deadly illness to our physical health, I thought as mental health professionals, let's have an honest conversation and start by just telling a brief story of our own experience in this weird time of pandemic and isolation, or something that we've witnessed. And once the 3 of us talk about that, I want to sort of have an honest conversation about fleshing it out, about the real impact on all of us, on mental health professionals, on health professionals, frontline people, and our families and our homes. And then we're going to talk a little bit about resources that are being stood up, especially for people that are experiencing trauma and secondary trauma and complex grief and deferred loss. And then we'll take some questions. How's that sound? So I'll start. My little story is that I know that I'm mental health impacted because every time I go to speak and thank to the healthcare frontline workers, I just start crying. I'm the designated weeper for this like hardship that I look into their eyes, into their masked eyes, and I just get all choked up. And I realize that, these aren't just statistics, that these are, that I'm looking at people in a battlefield, and just the act of appreciation or for some people, dropping off masks and gloves or groceries or things that they need, that being of service to somebody who's being impacted, it just really moves me. And I realized, okay, I'm creating a little vessel of grief in that moment, and it's sometimes missing from that very public stages of the governor's press conference and the statistics and the metrics and all of that data. That's not the story. The stories of each of us are in those little moments. So I find it surprising that I am you know, frying. I don't expect it just wells up like that. So that's how I know I'm being impacted. What about Mary?
Yeah, I identify with that. I think the little pockets of grief that are spaces where we can let ourselves feel. And for me, I think that I was always someone who was very busy and doing a lot of running around. And this has been such a time of course, very busy with work, but profound stillness at times on the weekends where there's no running around. We've done about 1,000 loops around our block on bikes and rollerblades and every possible way to get around the block, and that's become kind of our little world. And so just sort of the stillness that I think we're so uncomfortable with, and I hear it in a lot of clients as well. The emotional pain that maybe lives right below the surface, and that we stifle with busyness and we cover with busyness, and then you take that away and it just sort of pours up and out any chance that it gets. I think in the initial stages of hearing about what was happening, I was focused very much on how this was going to impact me and my life and what I needed to do to adjust. And then you just become so overwhelmed with the like see the numbers on TV, and you hear the stories of people impacted and in so many different ways, and it hits you.
Yeah, thanks so much for that. Yeah, you're such a witness to not just your own, but to your clients and your practice, and holding that space for them. How about you, Wendy?
It has, I've been most struck, I think, by sort of the paradox of feeling like I'm okay and I'm not okay. I'm a college professor, and when we transitioned to distance learning, now I've got students in 12 time zones, and they have different access to internet depending on what their governments allow. And it's been sort of a touchstone, I think, for all of us, for me to have to show up for a Zoom class. And on one hand, I recognize the importance of maintaining some sense of normalcy and showing up and sort of having that public face of the person who's shepherding this learning process. And on the other hand, because we're talking about psychology, and particularly social psychology, there's also the reality of talking about how we're managing collectively different places in the world. I think I had the gift today, because I had grades due, of being home alone for the first time. My husband took my son out to visit his parents, my son's grandparents. And first of all, I was just struck by I treasure being alone. I love my family, but just to have the solitude, and I was really basking in that. And then I was playing a little guitar, because I'm grieving not being able to play as much. I miss my band. I miss playing with my husband, even though we were in the same house. And then just completely overcome with grief, I've lost colleagues, I've lost students. I'm aware of the intersectionality of different people's situations, overlapping disadvantages, and it's a lot. So thanks for asking.
Yeah, so sort of like Mary, in that stillness is where the grief comes up when you're alone, not.
Yeah, because the moment my son walked in the door, then I had to be that, the mom persona, the role, and, shepherding him through this hero's journey, mythic experience for a 6-year-old. So it's tough.
Carissa, tell us about you.
Hi everyone. How are you? I guess it's been hard for me on a few different levels. Personally, just not being around people and friends, and just engaging and able to open up and communicate with people on a face-to-face level. So that part of it. And, you know, I work at the VA and it's just been hard. I've lost a few patients that I've seen and talked to on the phone, and then they got COVID-19 and just, you know, them dying alone and not being with anyone. It's just been heartbreaking for me. I used to work in oncology for a long time, and I thought I could be okay with it. And I think, like, at least in oncology, I knew what was happening, and like I have no control to help them. So that's been hard. And then just, you know, dealing with people, you know, who are really psychotic in my job and not being able to see them face to face and give them the help that they need. It's been hard. Like, you know, I haven't been going to work, you know, but I'm not somebody who, if I had to go and work with people who had COVID, I would do that, you know? So there's been a little bit of, like, one of my patients is very psychotic, and, you know, he needs to be seen, and he needs, you know, medication, like, you know, an injectable. I'm not sure if you guys are familiar with that. And, you know, it's been like, well, I don't know, should we bring him in? It's like, well, he still needs to be treated regardless, you know? And so, you know, where's the line in regards to treatment and, like, you know, being scared and holding back? And I, you know, so that's something that's been, you know, an ongoing decision. And I just feel strongly like these people need help. You can't just stop everything. You know what I'm saying?
Yeah, well, that's actually a really good segue. I want to ask Dr. Carissa Phipps, because I know she's got to leave in a few minutes, but about her impact, and also what is the role of telehealth in this pandemic?
Yeah, and it's scary. You know, I haven't, knock on wood, had anyone, you know, commit suicide or, you know, say that they want to harm themselves, but I have some colleagues that it's happened, and I just, you know,
Yeah.
get anxious about it, to tell you the truth.
Sure.
So much happening. Yeah. And I think with all of that happening, I know I've been really joining in my clients, and we've been kind of joking, saying, you know, we know what an emotional roller coaster feels like. We've all been on them, but we feel like right now we're living on one. Like I say, we have packed our suitcases, we've brought them onto the roller coaster, and we are living on the roller coaster because we don't know when this is going to end. And so I think it's been really difficult to see consistency, like, in a lot of ways. Myself, and I've seen in a lot of my clients, there being like one day where they're going to tackle some kind of home project, and then the next 3 days, all they can really do is like binge Netflix, and just really having to be compassionate with the ups and downs of that, and to know that it's hard to find momentum right now when we are experiencing so many emotions. There's so much uncertainty. There's no change of scenery, which I think we often underestimate. Even just that drive to the office or home, that just the change of scenery kind of resets and gives us these new beginnings that we don't really think about. And so it's difficult, I think, to just get momentum and have consistency. So I think just, you know, I know myself, and I've seen my clients just kind of be all over the place, and really having to check in with compassion and kind of meet ourselves where we are each day. And that just becomes really important. As far as telehealth goes, I think that it has been valuable for a long time, but now in these times we've really had to embrace it, because it's kind of become in many you know, for many folks, the only way to access treatment of many kinds, including mental health. I'm hoping that coming out of this, that telehealth is honored and will really continue to be an option, because it's needed to be an option. There, you know, this is all of our world now, but there's been folks who are immunocompromised or have chronic health issues or don't have transportation issues. Those folks have been there and have needed it, and now we all need it. And I hope that even when we go back to not everyone needing it, that it'll still be an option for everyone.
You want to just briefly talk about the equity of that and the fight you're in with insurance?
Yeah. So Connecticut has, been a real champion of telehealth for many years. We've had telehealth parity here. Where we run into problems, though, is that there get to be exceptions. Self-funded plans where employers pay for their employees' insurance plan out of their own pockets, those are exempt from any state law that we put onto insurance coverage. They're regulated by the federal level. So even though right now our state laws say, you insurance companies have to provide telehealth, there are many exceptions. And even right now, there are some folks that don't have telehealth coverage because their employer can opt out. So that's kind of a federal level fight. But currently, the insurance companies have put in a lot of temporary policies that have increased access to telehealth. They have waived cost shares for telehealth visits. And again, that's something that also self-funded plans can opt out of. So not everyone is participating in that, and that's only specific insurance companies. One really big win that I think has been coming for a while, but really got accelerated when the pandemic started coming, was that Husky now reimburses for telehealth coverage. So our Medicaid clients in our state can now benefit from that. And that is, there's been some confusion, but that is an indefinite change that will be here even when the pandemic, it's hard to even say when it ends, right? There's just so much uncertainty. Like, I don't even know how to phrase that. Like, but so that's a really huge win. We're also looking at pay parity. Right now, it's legal for insurance companies to reimburse less for telehealth visits for providers, mental health and medical. And so right now, there's really only one major insurance company that does that, but there's nothing right now saying that any insurance company couldn't decide to. And I do think that, unfortunately, the reason why insurance companies really try to put barriers in the way is because they know that if we have equity, if we are moving towards access, that more people get to use their benefits and more people get to get healthcare coverage and mental health care. And that scares them because that goes into their profits. So we're fighting to shut down these loopholes and to keep doing what we can to regulate insurance companies and push them to keep offering telehealth and making it accessible to everyone. And so, yeah, hopefully I didn't go on and on too long, Anne. but that's kind of where we're at with telehealth.
Yeah, there's so many important points that that we need to have this honest conversation. One, I just wanted to go back to that transition. We're in the same place all the time and not having that change of scenery. I remember my husband and I used to live at the camp that we directed, that we lived and worked at, and there was another beloved staff member, Josh, who lived and worked there too. But he would get up every morning and drive around the lake to go to work, like to just get, and get coffee. But like, he had to like drive to work, even though he lived and worked in the same place. Like, who knew that would become a radical act of self-care in the age of quarantine. But transitions, and also because we have no certainty about this timeline. The goalposts just keep moving. Are we going to open up? Are we going to have in-person school? We just heard, it was only a week and a half ago that no, we're not having in-person school for the rest of the, school year. And so we're certain about that, but we're not certain about opening up or when we can go to the doctor's office or those kinds of things. And the second thing that I want to have that honest conversation about is that access to health is like so critical, that we're just now realizing that there's going to be a huge wave of trauma, and we've already seen it. Clarice talked about suicides, and we talked about, just we haven't talked about yet, but the escalation of incidences of domestic abuse, of all kinds of domestic violence. And we have to figure out as a country how to have access for mental health as well as physical health. Where one of the reasons that this has impacted the US so profoundly worse than some of our other first world countries is because we don't have taxpayer funded access to healthcare, mental health care, interest-free college, living wage childcare. We have a childcare crisis. There's all these moms and parents working from home, trying to homeschool, trying to manage their job or leaving their job so that they can homeschool because they have no childcare. And that is clearly a crisis. It's clearly a crisis that we don't have affordable access to healthcare, like you were saying. So we have people, 26-year-olds dying of for lack of insulin. This has broken wide open the inequities that we just take for granted and as normal, and they're utterly unacceptable now. So yeah, medical bankruptcy. And I wanted to also speak to and see if this is something that you can, just in the last couple of minutes that you can be with us, Carissa, too, is that because this global pandemic is impacting everyone, it's impacting people that aren't used to reaching out for help and certainly aren't used to reaching out for mental health. So what are you seeing in terms of people accessing resources or support, or is it not yet?
And other folks too, feel free to jump in, with your own takes on this, but in my practice, I've seen calls be way down. In the past week, I actually have started to see things start to pick up again. So although what I was just saying about consistency kind of seems to be the same for how people reaching out and not reaching out, I've had some folks reach out and not follow through. So I think that overall, I would say not yet, but it's starting. I'm starting to sense it. I'm starting to feel it, and see the influx of folks reaching out. I think that it's, I think in some ways it'll be interesting to see, like, the fact that folks, don't know that telehealth is a thing, because I think a lot of people didn't even know that has been an option, and for, in some ways for a while. If that will kind of open the doors, like you were saying, to people that might not have reached out before, but really kind of feel like they have permission to now. But I also think that there's a lot of issues too with just finding a private space to have telehealth appointments can be difficult. And so yeah, I think I don't have a clear picture yet. Okay. But those are some things that I have noticed.
I don't know where Mary is. Did she jump off? I was wondering with her practice. I think sometimes people get kicked off.
She might have gotten kicked off.
She's not on the call right now.
Yeah, she got kicked off before too. Do we have a limit on this?
There's no limit on the DTCs in terms of time. And the limit of people, I think, is 300. So
okay.
It's not as a result of that.
Wendy, in terms of students and college students now in this, warped experience, do you think that there are more resources available? Are people reaching out more for help? Are they looking at the professors to provide that? What are you witnessing?
Yeah. I don't know how, directly who is reaching out or who's not. I do know that I have some students who are accessing resources. I did, when we transitioned to social distancing, I switched up the syllabus a little bit so that we were looking at health, stress, and coping early on. And so I had given them an assignment to do some research to find out what was going on wherever they were in the world. So at least they're aware. Whether or not they're actually reaching out, I don't know. You know, we also talked about things that they could do for themselves in terms of grounding and getting in touch with their feet on the earth and the breath, and also, you know, different kinds of coping strategies, emotion focused coping and problem focused coping. And so they are, I think, looking to professors in some way to bounce some ideas off of, or to, you know, for informal advice. But I'm not a clinician, so I don't play that role with them.
Here at the VA, I don't know, I've never been so busier. Like people who I, you know, I haven't talked to in 6 months, you can't get a hold of them. They're like, please call me every 2 weeks.
Wow.
It's interesting. People have like schizophrenia. It's not even phasing them because, you know, that's what they're used to. So
Yeah.
they're like, there's no change in my life. I'm fine with the social distancing. I'm fine with, you know, not seeing people because that's part of their illness.
Right. Mary, are you seeing a change in terms of people reaching out that have never reached out before because of this unique pandemic?
You know, I think in the initial stages, you know, of the first week or two, we typically get, you know, 4 or 5 calls a day, and we weren't getting any calls because people were in such a sense of hunker down and not being able to organize their thought process to make plans.
Yeah.
And I found myself in that same thing. You know, we were like, you know, when does the dog need his vaccinations? When do, you know, it's almost like you can't think about the calendar because you're in survival mode, and you're, you know, in terms of Maslow's hierarchy of needs, like your security and safety needs are not met. And so how can you plan for the future or plan to address the emotional component? I think as this has gone on longer, people are you know, reaching out more and more because they're realizing that this has become a more permanent part of life. And so that there's no reason to delay dealing with the mental health aspect of this, because you know, I had one client who had taken a break. She didn't want to do telehealth, and she called last week and said, listen, I don't know when this is going to be over. I can't afford to wait until this goes away to address my mental health needs.
Right.
So it's interesting that I think we're all starting to try to figure out how to do life and how to deal with the emotional parts of ourselves in this sort of, you know, not best practices world that we're living in.
Yeah, that's so true. The not best practices world. There is no sort of best practices for a global pandemic that could have economic devastation, sudden unemployment. I mean, you know, that is the triage, right? You talk about Maslow's hierarchy of needs. We first have to have our basic needs taken care of, and safety. And we're not really clear on that because the virus is everywhere, and we don't know how, and it could be deadly, and we don't know, you know, everything about its transmission or quite how to keep ourselves safe. So that is a huge stressor on everyone. And so I thought I would just name a couple of things and help me out here with naming what you're seeing too. But I'm starting to see secondary stress on, again, on those frontline workers, EMTs and nurses and doctors and CNAs that are, or healthcare professionals that are losing people that they can't help. I'm starting to see in just the community and certainly among many constituents who are losing family members, beloved ones, that complex grief because we can't get together. We can't have those rituals of closure. We can't see our loved ones when they're dying. And so there's just all this abbreviated grief that is sort of suspended, you know, and that's that complex grief is going to also compound trauma. And the other thing that I'm just seeing is this uncertainty with we don't have any sense of timing and hope of what the other side's going to look like. So how do we get into a structure of the day to day and make a life out of the day to day when we're looking at a long term siege, really, a long-term siege.
I think that's so important because I think I can't underestimate the importance of our ability to make plans and to look forward to things, to look forward to the next time we're going to see someone and give them a hug. And that when we can gather, when we can celebrate, you know, those sort of or when we can grieve, you know, when we can join with people. You know, and so I think that's been one of the biggest losses, sort of that sense of order and predictability that we felt that we had. And
Yes.
perhaps we never really did have that truly. You know, I think I've seen a lot of anger and rage coming out from clients. And, you know, a lot of that to me is that sort of sense of control and order that we felt we had, that we now realize we don't ever truly have, you know, because, you know, something like this can happen. And when we're confronted with that, with our powerlessness, I think it's very startling, and we want to blame. You know, who can we blame for this? You know, how can we sort of deflect? Is it the people that are not wearing masks, the people who are wearing masks?
Yes.
You know, it's everyone is sort of people are so short with each other. There's a lot of hostility and tension and fear because there's such a strong sense of, you know.
Can you close this door? Sorry.
There's such a strong sense of a lack of control over our own efficacy.
That's so true.
Yeah.
That's so true. I'm so glad you mentioned the anger and the rage, because I have a saying around here that no one is wrong in a pandemic. But that's to really just get an understanding that we should, that the rage and anger is a completely valid response
Right.
to what's happening, and some people are being impacted unfairly and horrifically, and in some sense preventably. I mean, one of the things I've been hearing from is these heartbreaking stories of frontline workers that don't have enough protective equipment, especially in the more you know, vulnerable Medicaid nursing homes or private Medicaid places that are they just don't have enough protective equipment, so they're reusing, and they're exposing themselves and they're exposing their families, and they're terrified. And this is outrageous, right? Rage, outrageous. That we are unprepared, and we could have been better prepared for a pandemic.
Yeah. Yeah, it's natural to feel that, and at a certain point, I started turning the news off as self-care.
Yeah. Oh, absolutely.
Because you start going like this at the TV, you know.
Yeah.
Yeah.
Yeah. Wendy and I were talking. Was it yesterday, or who knows what day it was, because we have no sense of time. But about you know, these feelings of resentment. I'm resentful of my husband when he's in a good mood. Don't you know there's a pandemic going on? Or, you know, like not matching what I feel like should be the you know, mood of the day, or and reminding myself to be compassionate towards my own sense of failure and lack of productivity and lack of, you know, remembering to keep to a certain schedule or getting back to people in a timely way, because all of that is out the window, you know. And I know I'm under stress when I don't sleep well. I mean, it could be menopause too, but you know, I think that disruption in sleep is a really good indicator that you're under that secondary stress, you know, of taking on that anxiety and grief for other people.
Yeah, and I think it will be interesting when we have time to talk about how this has impacted us in our households. You know, for instance, I have a highly extroverted and a highly introverted person in my house, and that causes conflict. Or I can keep breathing for the first 72 times I've been interrupted, but the 73rd time, you know, I have a harder time. And we're all doing more jobs than we used to, whether or not we have kids that we're schooling, we're washing groceries, or we're all doing many, many more things. So this sort of frustration, all of our efforts that are frustrated causes a little bit of aggression, and there's a lot of emotional leaking everywhere, and it's tough to keep it together.
Yeah, and expect ourselves to keep it together all the time, 24/7.
Yeah.
For the long haul.
Yeah.
For the siege.
And again, you know, that we're, most of us having many more roles, we can't do 100% at every job we do all of the time. So, you know, letting go of, I hear from a lot of friends who say, I'm just not doing anything well. I'm working harder than I've ever worked before, but I'm not doing anything well. And being okay with not optimizing all the time. We have to satisfy some of the time, and to be okay with, you know, we're getting up in the morning, if we're lucky, and we're getting through the day, and
popcorn for dinner.
Yeah.
Shower every 3 days, you know. Yeah. COVID hair. Yeah, these are the small things that are marking our new territory.
Yeah.
The other thing, and Mary, feel free to chime in, I wanted to speak to, is that our culture has usually interpreted our experiences as individuals. Like, this is what we're used to, is our practice, that if we have a diagnosis, if we are ill, if we have a job, you know, we're defined in our individual status. But this is a collective pandemic, and the failures of our collective systems have made it way worse. And yet we take it on as individual moms doing a bad job, as individual workers doing a bad job, as you know, as individual people, you know, becoming unemployed or underemployed. And yet there is wholesale federal failure to respond adequately to the collective crisis. So we're in a collective crisis, and yet we're interpreting it as individual, you know, impact and trauma. And that is something that's kind of uniquely American, not exclusively, but other communities turn towards their government for expectations of an adequate response, of of wholesale testing and protective equipment and access to treatment and healthcare and childcare and, you know, Red Cross or whatever in a big crisis like this, in an emergency, in a prolonged emergency, in a war.
Yeah, you know, in the US, we are largely an individualistic, independent, valuing society compared with other countries in the world, many Eastern countries that are collectivistic and have a strong sense of interdependence. And it would be nice if one of the things that came out of this for our country is that we have a greater sense of interdependence of caring for our neighbors and being invested in doing the right thing for all of us. You know, it would be nice to see that.
Yeah. Welcome back, Mary. You keep getting kicked off. I don't know why.
There we go. I'm not sure why. I seem to be booted off every 6 minutes or so, and then I re-enter. Speaking of not best practices, but thank you for your patience with me.
Yeah, I was just wondering if you had any observations of, again, when people are coming for mental health help, that we are in this culture, we have this quirky thing where we take it on as an individual versus a collective experience. And so when you know, a mental health client or patient is coming for therapy or for counseling, they're coming as an individual, but we're experiencing this impact and this trauma collectively.
Yeah, it is so interesting. You know, I think that it's a fascinating time to be a counselor because in some ways you are a small part of that collective experience where, you know, I do hear 30 or more stories of how different individuals are impacted every single week. And so I hear from, you know, the RN who's working on the front lines in the hospital, and the mom who's trying to hold it together at home and homeschool and do her job, and the dad who's trying to do the same but misses, you know, the sort of camaraderie of the office and is grieving that and is dealing with an aging parent, and then you hear the story of the aging parent, and it's just really interesting to sort of see how differently and yet similarly we're all impacted by this. And how alike we all are in the things we value and the things we prize and the things we need and want. You know, and so you sort of hear your story told by so many other people and relate so much, but never before as a counselor have I been in a position of sort of saying me too to everything someone's saying. So it's an interesting thing to connect and identify so much because you're really kind of in the same place. And so you can't say, here are all the answers, because this is fresh territory. There are no answers other than I'm here, I'm holding space for you, you're holding space for you with me. You know, we're going to sort of let this be known and felt and experienced in this moment, because if it's not, you know, then there's going to be a secondary symptom, there's going to be secondary trauma, you know. It's not going to be healthy to bury it or to have it come out sideways. You know, it's got to be expressed. You have to say it, you have to yell it, you have to, you know, do whatever you can do to kind of not hold all of this in right now, because it's mission impossible. It's more than we can handle, and it's okay to not be able to handle it, because none of us are.
Yes.
A lot of people talked early on. A lot of moms talked to me about how, you know, they were looking at things on Facebook and Instagram about, you know, the perfect homeschooling parents. And, you know, well, so-and-so did 6 hours of crafts with her kid and I didn't do any. And, you know, they're competitively quarantining. They're quarantining at me. I can't take it. And I identified with that too, because, you know, as a working parent, you know, it's hard not to compare and say, well, I don't, you know, how much time am I able to do homeschooling, and what I thought I'd be a better homeschooler than this, but it turns out, you know, maybe I'm not, and maybe I have to feel that. And, you know, that doesn't feel so good. It doesn't feel egocentric that, you know, I'm not, you know, maybe as good at this as I thought I might be. And you know, the self-forgiveness that has to come into play is at every moment. and letting go of the comparison trap and putting
Yeah.
down the phone or the computer and saying, I'm going to do this to the best of my ability. And I can't look right or left. I just have to do my personal best, which some days is just, bathing one of the kids, which is an accomplishment.
Yes, and this is your day, kid.
Right,
Like,
your day, get in there.
we're winning quarantine.
Right.
Winning. This
Winning.
is what winning looks like.
Yeah, the problem is it's always the same kid, the one who likes to get in the bath, the other one, I don't know. So it's, but it's hard, it's not something that we were trained to do. And it's not really something that, we're taking, you're adding 5 jobs to the one job that was already hard.
That's
And
beautiful.
so we're all stressed, and it's, we are in it together.
We're
We
in
are
it
all
together.
a parallel process.
Yeah, well, that was just beautiful. What a beautiful testimony to holding space for that deep listening and having that me too experience of identifying with certainly all that basic emotion and all that basic release that's going on. That is the honest conversation I wanted to have about mental health, is that we're interconnected, we're in it communally. The only way I think we're going to come out of it is together, helping each other out, this sort of mutuality of extending ourselves. And for me, the thing that helps me not wallow in despair is service, is somehow being of service to some other people. It just creates a shift from despair for me. So I recommend that as part of frontline mental health CPR, if you will. So let's talk resources. So what are some basic resources for people out there, self-care or reaching out for help? What do y'all recommend?
I'd love to just touch on the point that you made about service. And, I'll say this one thing. There's a wonderful quote. I think it might've been Winston Churchill. I'm not sure. Never let a crisis go to waste. That came to mind when Carissa was speaking about the transitions in, making mental health more accessible. Historically, Husky insurance, did not cover telehealth.
That's right.
But it also didn't provide adequate transportation for people to get to their telehealth appointments. So, for many years, we've seen Husky patients, we would coordinate a time for transportation to bring them to their appointment. But the transportation that was provided would come an hour late, or would leave them there for an hour at their therapy appointment and not come, and so it was underutilized. So so this one window of this pandemic is that now these people that were not going to have literal transportation to their therapy appointment can do it over telehealth, and it'll be covered. So that's such a positive outcome of that's one example, right, of good coming of something horrible. The other thing is with the telehealth pandemic, or with the telehealth issue, is that I think that there are so many people that are chronically ill who now may be able to receive services, and we see a lot of them, and they just don't have the access. So, I think we are finding sort of like little silver linings. And I guess, I would say in terms of self-care, trying to find those silver linings is really hard some days, but I really do try to find them. And, like right now, the weather's getting nicer. We can get out in the fresh air and spend more time with family, and spend time maybe getting some movement You know, some people are growing gardens, people are baking, people are talking on the phone, and they're maybe having deeper conversations than they would have if they just saw people in person, because, you know, they're actually speaking instead of just sitting in the same room together looking at their phones. So there have been some
You're so
positive
right.
changes that have come. And maybe when we get back to life, we won't be as crazy and as busy and as overscheduled. Maybe we will have learned something. So, you know, I mean, I just try to do like 1 or 2 things a day that, you know, help me to kind of set myself, like, for example, you know, I try to get out and walk every day. That's something I didn't do before. I always complained I never had time to exercise. And now I, you know, I can't make that excuse. So I get out and walk, and it does make you feel so good, to get your steps and, you know, drink your water because you're right by the sink. You could just fill up and, you know, and, you know, you're only 10 feet from the water dispenser. And, you know, there's kind of no excuse not to sort of, you know, do these basic self-care items that make you feel so much better. And then reach out for help if needed. You know, there are so many good resources, and, you know, the fact that there is telehealth, I think maybe makes it a little bit more accessible to be able to bring therapists into your house, you know, to literally have that conversation in your PJs. You don't even have to worry about getting childcare if you can't. You can put the kids in front of a movie and you know, sit in the other room and talk to somebody. So I think there are some, you know, some little tiny silver linings.
Absolutely. All of those things. Wendy, you want to talk about your garden?
Oh, just that I'm gardening finally. One of the big long life things that, of course, we went
Life goals?
overboard. Well, you know, I grew up in 4 generations of farmers, and my husband grew up, you know, near Yukon agriculture, and we'd always wanted to, but never had time. Now we're not commuting, and now we're thinking about the prospect of needing to grow our own food. And, you know, it's great to have a child to pass that on to in terms of skills and awareness, you know. Yeah, I wanted to echo something that Mary said, that, you know, we're none of us are trained for this, right? That we have this universal commonality in very unique ways. But I think one of the things, Anne, that you've done here is by opening up a sort of public, honest dialogue, for people to be able to say, we're not doing it perfectly, but to remember that even though we don't know what we're doing, we're building capacity in some way. You know, this is, you know, something that we are getting better at.
Yes.
It's, you know, some days better than others, you know, and again, depending on what our each individual circumstances are, you know, we may have more going for us or against us. But yeah, I think it's important to be having conversations like these. You know, we're so used to, with media and social media, this social comparison, and you know, thinking that we have to keep up in some way, or we have to measure up in some way, or be valued in some way. And that there's a lot that's problematic in that, right? That lots of times we feel less than, or we feel like we can't, or we're not doing well. But to remember that we're growing capacity. Let me just leave it at that.
And I would like to also acknowledge that you not just grew capacity, but adopted fostered a dog in this pandemic.
Yes.
To be of service, you know, and
thank God
yeah.
it's considered essential travel for our dog. We have a single child and lost a dog in November, so we weren't quite ready to have a new dog, but you know, we were really thinking of that in terms of our son's mental health. You know, he wants to know, why can't we just get another brother or sister? And that's not an option for him, unfortunately. So praise to all the people who are doing pet adoption too as frontline workers, because we didn't know, we had the last dog that we rescued was 15 years ago, so we didn't know there's this whole sort of online dating matchmaking of dog ownership. And so we worked with a wonderful agency in Ridgefield, Looking Glass, but the dog was actually in Louisiana, which was another hot spot, and they were just really wonderful. And it has made a huge difference to have that calming spirit in the house, even when it's rambunctious, and to have that companionship for our son when my husband and I are working and he's fending for himself some of the time.
Wow. Wow, that is so great. That is just so great. The basics, get a dog, drink water, go for a walk. I think that we will get through this, especially as Mary was saying, have a new appreciation for our mutuality and hardship, and give ourselves a break. I would just want to spend the last couple of minutes opening up to any questions, because I did want to kind of honor our hour and a few minutes. So who has a question for our forum on mental health impact, or a comment?
And make sure you can unmute everyone too from your screen.
I think I can, but I don't know if
Nadine is not unmuting, no matter every
What
attempt that
we
I've
do.
made, she's gone back to being muted. So
Oh, Nadine.
Okay, you got me. I'm here.
Great. Does anybody have some questions for our forum?
Well, I have a comment. I just want to thank you all. You put a lot of language on things that we were feeling, which really helps, because, a lot of feelings of inadequacy or unproductivity or just feeling lost at sea. I've been making notes since you guys were talking, just this idea of deferred loss and complex grief and emotional leakage. I mean, this kind of language for somebody like me, this is very helpful. And actually, in terms of even talking to friends or relatives or my own kids, when they're describing, oh, one day I can get stuff done, one day I can't do anything. So just kind of saying that, just having some language to describe it, saying it's something common that you guys have observed in your populations, just makes everybody feel a little less alone, and I really appreciate that. So thank you.
Thanks, Pat.
Thank you.
This is Nadine here.
Hi, Nadine.
Hi, I just wanted to say thank you to everyone as well. And, I'm actually doing pretty well, all things considered, but I am concerned about others. And I think the idea of helping others is really important. And I plan on, along with my daughter, trying to help others in this crazy environment. And I think that really will help not only others, but ourselves. And I worry about the young kids. And I have a daughter who's a rising senior in college. And I can't even imagine what the parents are going through that are homeschooling and trying to work. So it's amazing that they can get through the day at all. So I hear everything that's been said, and I appreciate you putting this together. It's important. It's very important, the mental health of everyone. So thank you.
Have we lost Anne?
I don't know.
It's
possible that Anne's connection might have dropped as well. Did anyone have any other questions that they wanted to chime in with?
If we have a moment and no other questions, I wanted to respond to something that Pat had said about language and the idea of emotional leakage. One of the things I've been thinking a lot about in terms of sequestered dynamics is often we might feel hurt or annoyed or have a emotional response to a person in our household that it's more the situation than the person, but because we're sequestered with a certain number of people, it can feel like we start to have a feeling towards the person as opposed to saying my patience is thin because of the situation, not because this person is causing me to feel a particular way. But I think for my students, that has been a really helpful idea of attributing something to the situation as opposed to the individual. So.
I totally agree with that. In fact, today I had a situation where I was talking to a family member and I had to get off the phone because she had definitely different ideas about things and what was going on. And I found myself very agitated afterwards and snapping at my husband and my daughter. And I actually said to them, it's what happened on the phone call. It's not you, and I'm sorry. So if you can acknowledge it right away, I think it's, saying it's the situation and not something they're doing. It's important.
Mm-hmm.
Well, thank you all for sharing. Did anyone else have anything else they wanted to add or ask? Okay, well, I do believe Anne's connection has dropped her off, so we wanted to go ahead and wrap things up. And I wanted to thank everyone for joining us. Thank you so much, Wendy. Thank you, Mary, for joining us. And I know that we had Clarissa leave a little bit earlier on, but she had messaged as well, and she said she appreciated being a part of this, and she thanked all of you for having her as well. So if anyone else does not have any other questions or things to add, I think we'll go ahead and wrap things up, and we will be sharing this afterwards. We'll take the recording, we'll be sure to share it online, and we'll go from there. And hopefully we'll keep the continuation of the conversations going, whether it's through comments on Facebook or elsewhere. And we'll just keep looking out for each other in the community here in Easton and in Connecticut at large.
That's great.
Great.
Thank you, everyone.
Thank you.
Everyone.
So much.
Thank you very much.
Be well.